Hello, you've been asked to have chemotherapy for your breast cancer, and this video is going to try and take you through some of the side effects of chemotherapy and try and discuss some of the benefits versus risks of having chemotherapy. Unfortunately, you've been diagnosed with this cancer and you must be under a lot of stress. However, now modern chemotherapies and modern treatments to try and reduce the chances of breast cancer coming back have been highly successful, and that is a huge boon. However, chemotherapy does come with a few side effects. One of the main side effects of chemotherapy is that people are absolutely overwhelmed because they've heard so much about it that before they actually go ahead and have the treatment, they lose the battle. My suggestion to you is that go ahead, listen to your doctors and have full confidence on the team that is treating you. Chemotherapy is treatment with medicines. Medicines are often given as a saline drip or as bolus injections. Medicines can often also be given by small injections under the skin of your tummy or skin of the thigh. These chemotherapies have been time tested. Before being used on you, it's being used on thousands and thousands of women across the world, and some of the common side effects are the ones that we are going to discuss now. Chemotherapy has some acute side effects or side effects that happen very quickly. One of the main ones that you may be worried about is loss of hair. Yes, breast cancer chemotherapy does cause loss of hair. However, the loss of hair is temporary. The hair loss is just temporary and comes back as soon as you start the normal process after the chemotherapy. It takes a bit of time, however, the hair will come back. The second side effect is nausea, lack of appetite, and very rarely vomiting. Nausea, vomiting, and lack of appetite are rare nowadays because we have significant improvements in the medicines that are given to try and reduce the chances of nausea. We also give you medicines to take home and have as extra treatments just in case you have nausea at home. So please follow your doctor's recommendation. Sometimes people complain of constipation or diarrhea post-chemotherapy. The constipation or diarrhea often happens because of the effects of these medicines. Please discuss with your doctor. If you are very much constipated, you may need some medicines, and it goes the same if you have too many diarrhea or loose stools. It is better if you have too many loose stools to come to the hospital emergency or contact your specialist nurse or doctor, because it may also be because of some infections that you're having. This brings us to the point of having infection post-chemotherapy. Unfortunately, the chemotherapy that goes inside your body cannot differentiate between cancer cells and cells that are actually meant to try and fight your immunity. It targets cells that are growing fast. Cancer cells grow fast, so do cells that actually fight for you and give you the immunity. Therefore, as soon as the cancer cell starts getting wiped out, similarly, these immune cells are also getting wiped out, and this is what we call as neutropenia. If someone has neutropenia, they're more prone to get some infection. Post-chemotherapy infection is not uncommon. However, if you have early signs of infections like fever of around 100 degrees centigrade, or if you have too many episodes of vomiting, diarrhea, if there is redness or swelling on any part of your body, if you have a cough or a cold, come to the emergency straight away or follow instructions of your doctor. It is better not to call around people. It is often easier to come and get straight help from the doctor that you know in the emergency. Sometimes late side effects of chemotherapy do include a lingering fatigue, lack of attention, and these side effects do improve with time. Very, very rarely, chemotherapy-induced heart side effects or chemotherapy-induced side effects that cause certain very rare malignancies or very rare cancers of the blood have been reported. Now, why do we need this chemotherapy? But look, in spite of all these side effects, chemotherapy does give you a significantly increased benefits of having the cancer under control. This chemotherapy would give you a higher chance of a life without cancer. That is why your doctors are recommending that you have the chemotherapy. The way one could look at it is that chemotherapy is a very short temporary phase of disturbance in your usual normal lifespan. And this, once you get over it, will again get you back to your normal life. My suggestion is also that whilst you're on the chemotherapy, keep doing your normal work, keep meeting your friends. However, be careful that if anyone has a cough or cold or any infection that can be transmitted to you, please do not go there. That doesn't mean that you should not visit people. However, if people have cough, cold or infection, it is better to avoid that place. Finally, chemotherapy, especially modern chemotherapy, is given in a very safe manner, and your doctors, nurses, and the team that is treating you will ensure that you are actually looked after during the treatment. However, on balance, chemotherapy does give you an increased lease of life, and the side effects, often reversible, are worth it because we are looking at a long life without cancer for you.